So normally when you talk about herbal remedies, we usually refer them as complementary medicine, or we refer to it as alternative medicine. And in the last, say, about 2 to 3 decades, there have been a lot of research regarding alternative medicine. So it has good availability, good over-the-counter use, good tolerability. The safety profile is fairly good for herbal medication, and at the same time, it can be used for a big bunch of population who do not tolerate conventional medication. Probably due to side effects or overlapping effects. So there, the herbal use medication can be of a great use. If you see from the mental health perspective, the use of herbal medication has been, traced back to a very long period of time. We normally say that if there is any mental health concern, if there is any mental health issues, then definitely identifying the problem, reaching a good diagnosis, and formulating a good plan for mental treatment is important. And as a part of that plan, we feel that wherever traditional medications are required, they could be antidepressant, they could be anti-anxiety or sedatives or hypnotic. Definitely, they have a mainstay role. At the same time, counseling or psychotherapy has to be a part of that plan. A good amount of lifestyle modification emphasis is played in the treatment plan as well. And that is the place, the fourth place that comes in is the use of supplementation. So it could be food supplementation, it could be nutraceutical supplementation, or supplementation with herbal medicine. And so if you are able to incorporate all these four parameters as a part of a plan, when you are dealing with any mental condition, we've identified that the outcome has been the best. That is why the effectiveness, yes, studied extensively, it's quite effective. If you go to see the substances that are used, the herbs that are used, so right from the Ayurveda time, we are aware that there are so many Ayurvedic herbs, that have been used for a lot of conditions. And that also included a lot of physical ailment, and at the same time, a lot of mental health issues as well. So primarily, one of the commonly used substance, which we all know, is ashwagandha. So ashwagandha also belongs to, a particular class of herbs. We call it as adaptogens. So it belongs to a class called adaptogen. There's a peculiarity about these adaptogens. These adaptogens are a class of herbs which very slowly, very gently, they are known to regulate the body's stress responses. That's why these medications are to be taken for a prolonged period of time. A very short duration of use of adaptogens may not show much of benefit. They require like a kind of a daily supplementation over a long period of time, and they are known to alter the stress responses that the body generally gives. There are a lot of other adaptogens like ashwagandha. We are able to see something, a herb called, holy basil. Commonly, you would identify ginseng as another good adaptogen. You are also able to see ashwagandha and a couple of subsets used over there. If you ask me where primarily they would be used, yes, they are used in mental health condition. Normally, that we call them as neurosis. So all neurotic conditions such as anxiety issues, panic disorders, phobias, all that comes under the stress, anxiety, and the depression spectrum. They don't have much of a role when we talk about hardcore neuropsychiatric conditions such as psychotic illnesses, but the neurotic illnesses, the efficacy has been proved to be quite good. Specifically, the herb ashwagandha, it regulates the cortisol mechanism of the body. So cortisol is a hormone which is a stress hormone in the body, and it requires a particular regulation. If cortisol levels are not normal, you will see a lot of stress responses coming up. And a lot of those abnormal stress responses are seen in conditions such as anxiety disorder. So ashwagandha is a herb that needs to be taken almost on a daily basis for a prolonged period of time. It is a herb which is available as an over-the-counter herb as well. And also, if you go to see a lot of Ayurvedic practitioners who practice regular Ayurvedic medication, ashwagandha is one of the mainstay of a substance used in Ayurvedic medicine for mental health issues. So in particular, Superme, we are using ashwagandha as a PM component.
Okay.
But if you go to see technically, yes, the response of every individual would be a little different. Ashwagandha is a substance which can also be used at a very low dose, even during the day as well. So it's a substance which can be used during the day as well. But almost all the medication, all the herbal medication, or even traditional medication, but the moment there is an anti-anxiety element to it, there is always a possibility of a little sedation, a little drowsiness, or sleepiness. That's why most of the prominent anti-anxiety medications are prescribed in the PM.
Okay. I didn't realize that.
To avoid daytime sedation or daytime drowsiness.
Tell us a little bit about the role of magnesium in feeling calm.
So, if you look at magnesium as a compound, magnesium belongs to a micronutrient class of compound. Physiologically, it's a cation compound that we identify. It's a part of a micronutrient. Now, all micronutrients are known to have been playing a significant role in the central nervous system of the body, connected to all the nerves. So that's why in neurological conditions as well as neuropsychiatric conditions, magnesium, a cation or magnesium as an ion, has a significant role. Now, when you see neuropsychiatric condition, most of the neuropsychiatric condition belonging to the neurotic illnesses, we have identified that there is a deficiency of magnesium, or rather magnesium is identified to be slightly lower in the blood in those patients who've had neuropsychiatric issues. That is why initially when magnesium was started, it was used as a predominant and oral supplementation. And they would say that eat magnesium-rich food. So that would definitely give you a calming feeling, because a good amount of magnesium in the body improves the nerve conductibility, which is affected in conditions like anxiety or maybe conditions like depression, panic. So as you are improving the nerve conductibility, the passing of the neurochemicals which are concerned over there is far better. And in fact, that is what was the concept of the earlier concept of nutritional psychiatry. That what food intakes or what food contents would improve your mental wellness. So from there we started, and there are a couple of other substances. We all must have heard about omega-3 fatty acid.
Yeah.
It also belongs to the similar class. It also comes in the same aspect, that how nutritional content have a positive effect. Though the positive effect is not a direct effect of feeling good, but these substances like magnesium, which are now available in all forms. So we've identified that when magnesium is used in form of a trans patch, which can be applied on the skin, or when it is used in the form of a cream, the absorption of magnesium through the skin is equally good.
Okay.
And the moment magnesium gets absorbed from the skin, it directly enters your blood circulation. So a good level of magnesium in the blood is known to improve a lot of these, internal macronutrient bases, and that has a very positive effect on the skin and the brain. So the elemental magnesium has been significantly used for, calming effects like anxiety issues, specifically people, where we want them to desensitize over, a particular anxious feeling. So you have to understand all these substances take a little while for an effect to settle. So a lot of people may feel that if I'm feeling very anxious, I apply, suppose, a magnesium cream, I would get an instant sense of relief. That may not happen. So it has to be like a sustained daily use of it, and that is definitely known to have a good effect on it. Magnesium does also have an important property, which is an antidepressant or a mood elevation property. That's why they say that if you use magnesium or magnesium cream in the first half of the day, your day definitely begins a little on a better mood or a little elevated mood by itself.
Okay. How interesting.
So that can help you manage your stresses throughout the day.
Is this something that you would also recommend as like a first line of treatment when somebody may be a little bit resistant to taking on, starting to get on anti-anxiety medication or anti-stress medication, etc. Would this make it? Would this be a nice, gentle way to first try and address the problem without taking anything dramatic?
Definitely. So I'll tell you, in clinical practice, when we are using medication, the condition where we identify medications is important. That's where a prescription comes into picture, and we motivate patients to go on to medication because it's finally going to help them.
Yeah.
But there's a lot of resistance from patients as well. Some are not very comfortable. Some are very anxious just about taking neuropsychiatric medication. So there are these certain areas where we feel, these medications can come in as the first line. But yes, of course, the condition also has to be identified and well explained to the patient.
Okay.
So places where patients are getting severe panic attacks, where there is, major difficulty they're facing on day-to-day basis, their probably first-line use of these medications may not be ideal. But yes, where we get patient resistance and we want them to start onto the plan. So as I just first narrated, a plan for a particular patient in clinical practice, medication, therapy, lifestyle modifications, and alternative medicine. All four are in the plan.
All four work together.
Are in the plan, work together. Exactly. So there are a lot of patients who we feel, along with traditional, allopathic medication, even the use of supplementary medications along with it, patient would benefit, and some are absolutely willing to do that. There are some who are not very convinced with medication. So we see that these are the parts of the plan. Let's at least begin with supplements first. The moment you get some relief, probably you would want to move and be in the system. Want to do something for your stresses.